And I think I put off one question, which was, what about gallbladder problems after the surgery? It turns out that when you lose weight, the bile, which is part of your digestive tract, changes. And it changes similar to the way your radiator water changes during the winter. It starts to thicken up and can freeze and turn into stones. And so as you lose weight, your bile gets thicker, can form sludge and actually form stones, and end up needing to have gallbladder surgery. And 10 and 15 years ago, when surgeons did gastric bypass, they would always stop and take out the gallbladder. And they'd say, well, we're going to protect Mrs. Smith here from having to have gallbladder surgery later. And they thought that was a good idea. We think that's a terrible idea, and we never do it. And I'm going to give you kind of a long story to explain why. Some of our patients do get gallbladder problems after surgery, but we do have a medicine called Actigall, which acts like antifreeze and helps protect the gallbladder from getting sludge and gunk in it. And that's what we recommend for post-op patients. But more than that, we fear the seriousness of this surgery. So let me see if I can explain that. Today, we were discharging 5 people who had surgery yesterday. We had a patient here from Florida. We had a patient here from Oregon, a minister who drove with her mom all the way from Oregon. We had a patient from Northern Virginia. We had a patient from the White House, from George Bush's White House. We had a patient here from California. And all of those patients were going home. And as we sat there, I said, today is a day of celebration because this surgery can lead to death. I mean, this is serious surgery. And when we do our surgery for each one of our patients, we treat it with tremendous seriousness. And when we see our patients doing well, we really give thanks for that because this is serious surgery. And we've heard, I mean, we have 2 people who had complications. It turns out that right now, since I started doing the mini-gastric bypass in 1997, I've operated on 3,700 people. That's one of the largest series in the world. And during that time, we want to have the lowest risk of complications and death possible. But we know even doing gallbladder surgery, if you do 1,000 gallbladder removals, several people out of each 1,000 will die having their gallbladder taken out. Okay? And that operating time is necessary to take out somebody's gallbladder. Even a good laparoscopic gallbladder surgeon can require 30 to 60 minutes to take out the gallbladder. If we went back and removed 3,700 gallbladders out of my 3,700 patients, we expect 3, 6, 9, 12, maybe more people would have died, and even more than that would have had complications from their gallbladder surgery. We feel like the surgery itself is very serious, and while we don't rush, we take it very seriously while you're asleep, and we want you back. We want you awake, we want it safe, and we want out. So if you were to need gallbladder surgery after our surgery in 6 weeks or several months, great, because you'll be many times more healthy if you need to have your gallbladder out. And we find that not many people do. But this is serious surgery, and we don't fool around. We don't do a tummy tuck while we're there. We don't lift your breasts or lift your eyes or take off moles or fix hernias or take out your gallbladder. We go in as smoothly and safely as possible, and we're out. And you heard operating times here tonight of 30 or 40 minutes. That's really remarkable. Around the world, there's no one that has those kind of short operating times. And we think part of our good results are because of that attention to detail and not dilly-dallying while we're in there. And so we don't take out the gallbladder. So it's a really good question because it focuses on our approach to weight loss surgery.